Hello everyone. Today we welcome Dr. Pranavish, Assistant Professor, Department of Pulmonary Medicine, Safdarjung Hospital, New Delhi. Good evening, Dr. Pranavish. How are you doing?
I'm better, much better.
Okay. So while treating all the patients, you also caught the COVID virus.
Yes, and I'm recovering at home. I'm at home isolation.
That's great to hear and get well soon. So we would just ask you some questions regarding the COVID-19 pandemic that is ongoing. So India is experiencing its second wave of COVID-19, and we can see that the cases are rising day by day. And there are also people who are still not accepting the fact that the virus is there. They feel that it is a scam. So what do you have to say about it?
First of all, the virus is real. It is definitely real. We, in fact, have the entire genome sequenced also. Anyway, so for the general public, I would say COVID is a disease. It is evident. All your hospitals are full. It is spread by a virus which is highly infectious. And sooner or later, you have to let go of the denial. That is the first thing. The number of cases are rising, I agree, and there are multiple reasons for it. One is the virus has mutated to some extent. People have actually stopped following COVID appropriate behaviors. Despite vaccine, people are actually now thinking that they're immune to the virus and they are not following the appropriate social distancing, the masks, and various other which have been laid down by the government. So all these factors are contributing to a very, very high second wave, which is in fact, I think, causing infection to nearly 1/3 of people in Delhi also now.
Yeah. I agree with that. So this is a kind of lesson that the virus is teaching to everyone. So we doctors always say that prevention is better than the cure, but I think the people are not taking it very seriously, and because of which the wave has spiked a lot. So next I would ask that if anyone acquires a COVID-19 infection, what are the guidelines for home quarantine and for admission?
Okay. So first of all, the words officially are home isolation. So once we get ourselves tested and we come out positive, we are suffering from COVID-19, we can be classified into mild, moderate, severe. So mild cases are the majority of cases, and all of the mild cases can easily be managed in home isolation. Like what I am doing. So the best way is in home isolation, you have to be isolated. So as per English, you must have a separate room with a washroom where you will wash your clothes and utensils also. You will not come out or meet any other member of the family. You will maximum take in food from outside, but that will also be wearing a mask at a distance. So it is best if you keep a table outside your room. Somebody can put food there and you can collect it maybe later and return the washed utensils outside. This has to be strictly followed for 17 days as per our Ministry of Health guidelines. Generally, we are infective up to the first 10 days of symptoms. However, just for a safety point, the government has mentioned 17 days from symptom onset, not from the date of test, but from symptom onset as a safe mark during which one must be isolated.
Okay. How do you classify these symptoms as mild, moderate, and severe?
Yes. So fever, cough, cold, body ache, muscle ache, all these are common symptoms of COVID. We even have anosmia, ageusia, that is हमारी taste and हमारी smell sensation चली जाती है. And we sometimes even have gut symptoms like nausea, vomiting, diarrhea. All of these will come in mild category till they cause a lot of debilitation. That is, जब हमें सांस फूलने लगे, that is dyspnea हो जाए. Saturation probe में हमारा saturation 90 to 94 आ जाए. That is any value below 95. That goes into the moderate category. And when it becomes life-threatening, जैसे सांस आ ही नहीं रही है, it becomes into severe category. So every of these symptoms can be mild, easily managed at home, and hence the best way to classify for a common man who is at home is to have a pulse oximeter in his room. Pulse oximeter is something which you can apply to your finger and check your pulse and saturation. At home, it should always be 95 or above. Any value below, I would advise that you fall into the moderate category and you should be ideally hospitalized.
Okay. And what about like when a patient has moderate to severe symptoms and then he gets admitted to the hospital? So what are the lines of treatment that the hospital follows? Because as you must be knowing that the oxygen supply is decreasing day by day, and the news is all covered with people hoarding for oxygen cylinders at home.
So first of all, oxygen in hospitals come from various sources. That is a central supply cylinders. And as such, because of the increased demand, there might be a slight communication gap, but oxygen is available in most hospitals. What we must remember as general public is we do not need oxygen concentrators at home as a prophylactic measure.
Okay.
Nobody can predict the course, but we must monitor our saturation. And if less than 95, we should be admitted. We cannot manage moderate or severe cases at home.
Okay.
And on the other hand, for mild cases, we do not need any of these things like oxygen,
Right.
like Remdesivir. We come across a lot of news that people are taking Remdesivir at home. It is not at all advocated for mild cases. Even in government guidelines, even in studies, it has shown that Remdesivir is only beneficial in moderate to severe cases, that too by reducing the duration of illness maybe. So there is no mortality benefit. It is not कि आप Remdesivir लगाएंगे तो आप ठीक हो जाएंगे या आप मरने से बच जाएंगे, ऐसा नहीं है.
There is like hoarding
That
of
is
Remdesivir
very
as
true.
well.
And see, Remdesivir is an IV injection only meant for
right.
patients who are moderate on oxygen. So if you are moderate and you are on oxygen, you will be in a hospital, you will not be at home. So getting Remdesivir at home is not recommended by any guidelines and it is not beneficial. I would like to say, clarify in fact as a doctor. At home, what we must take is paracetamol for fever, maybe some anti-allergics for our cough cold, and depending on our symptom, like I told you, sometimes we even have nausea, vomiting. So we can take an antiemetic there. If we have diarrhea, we can take a probiotic there. So these are symptomatic therapies, which we can easily ask our local doctor or family physician. We do not need any specialized care. Neither is there any specific treatment for COVID. Many people say you must take azithromycin, some say doxycycline, some say ivermectin.
Right.
So as such, in the national guidelines, till now they are not mentioned. Of course, one can take if prescribed by a doctor, but it is not like they will miraculously cure you.
Okay. So next I would like to ask about vaccination. I'm sure the vaccination drive that has been going on all over the country is going very great and people are getting vaccinated. But despite of being vaccinated, people are getting infected with COVID virus. What are the types of vaccine, first of all, and whether one should take the vaccine or not?
So in India, we have two vaccines, Covaxin, Covishield. Both have been approved by the government. Both are safe and efficacious. One thing is vaccines cannot prevent infection by 100%. So do not think after getting the vaccine you cannot be infected. You may be infected, but it also decreases the severity of COVID-19. Besides, it also decreases the transmission. So if we have to break this change of second wave, we need mass vaccination. And as we all know, Government of India has now made it above the age of 18 years. So it is open for all.
Right.
I would advise each and everyone should get vaccinated. As per the dose schedule, for Covaxin, it is said that 2 doses 4 weeks apart. For Covishield, it is 2 doses 6 to 8 weeks apart. But each one of us should get vaccinated. And pre and post vaccination, we must follow the COVID appropriate behaviors. Our vaccine may be able to prevent infection, may be able to prevent the severity of infection, may actually even be able to prevent the spread of infection. And in times to come, to break this chain of transmission, I think vaccine is the most effective tool that we have.
Right. Like if you acquire COVID infection, so then after getting a negative report, then when can you get your vaccination done?
So first of all, even if you have COVID, you must get vaccinated later. So government guidelines at present recommend that there should be a minimum of 8 weeks gap because the current infection will give you some immunity and hence the vaccination may be delayed. But one infection does not predict that you cannot have a second infection. So you should always get vaccinated even if you have suffered from COVID recently, of course, with a time gap. In terms of indications, nowadays it's as simple. Anyone above the age of 18 should be vaccinated, I feel. And contraindications, yes, if you have some allergies to vaccines, if you have pregnancy or breastfeeding, at present they are like absolute for anaphylaxis, that is for reactions, and maybe relative for pregnancy and breastfeeding. Rest, all healthy adults, even if suffering from chronic lung disease, liver disease, kidney disease, or any other illnesses, should get vaccinated because the risk-benefit ratio is definitely in terms of the benefit.
Okay. Do you think that this wave will subside? How much time will it take to to decline? Because I feel the peak is not yet reached.
So actually, nobody can predict that. Epidemiologists believe that the second peak is always more dangerous, more infectious, and this is what we are probably seeing. Also, we now have more than 3 lakh cases per day from India, which is a big number.
Yeah.
And it is really hoped that this will eventually achieve the peak soon, will eventually start climbing down, maybe in the month of May, June. But again, we
Okay.
cannot predict whether or not we'll have a third wave. So all these things are there to stay. The COVID appropriate behavior, the vaccination, and the
Right.
self-monitoring, I would say, is here for stay. We have to take care of ourselves, of our family, and of every friends. And for that, we have to inculcate the COVID appropriate behavior in everyone, besides following it ourselves also.
Right. So, what would be your last advice to everyone to stay healthy, to prevent COVID?
I would say eat healthy, sleep healthy, take care of yourself, take care of your families. Do not stop any undergoing treatment that you're already getting for other illnesses. Avoid
Yes.
exposure to anyone. If at all you have to go out, wear a mask. Follow COVID appropriate social distancing of at least 6 feet or 2 meters, as they say. And it's better to use the e-world. Like in nowadays, I would say it's always better to use conferences, e-lectures, e-meets, so as to decrease our exposure as much as possible. And
Right.
once we have COVID, mild cases, please stay at home, please isolate yourself, do self-monitoring, you will recover. Within a week or two, your fever will also go, you will definitely start having improvement in symptoms, and do not spread the disease to others.
Thank you so much, Dr. Pranav, for your time. And we wish you a early recovery and take care of your family as well.
Yes, definitely. Thank you so much. Thank you.
Okay, thank you. Thank you, Dr. Pranav. If you have more questions, kindly put them in the comment box, and we'll try to answer your questions as soon as we can. Prevent yourself from acquiring this virus and stop the chain, and let's do it together. Thank you.